Hi, and welcome to Pulse, your weekly podcast delving into all things health, innovation, digital and data, proudly brought to you by Pulse+IT News. I'm your host, Louise Shaper.
And I'm your co-host, George Margellis.
Where are you, George, today? What's happening?
I'm back in Sydney for the first time for a little while. So it's been a fairly hectic couple of weeks since our last podcast. Yes, last week was the ARIA conference in Adelaide where the government announced the digital technology strategy. Week before was the aged care week here in Sydney. So it's been a hectic couple of weeks, but interesting as always. And of course, end of financial year, tying up all those little piece of paperwork.
Oh, man. Are you good with that? You don't have a shoebox of receipts?
Nah. It's more like a filing cabinet full of receipts that need to be entered in on the 30th of June. And yes, that's not my forte. How's your week been?
Well, my week has been good. I can't say I've paid attention to end of financial year. My accountant would attest that I'm hopeless because I think running a company, you have a lot longer to file your end of year returns. So usually he's chasing us like 12 months later going, we need it. But yes, I've got to get to that. Thank you. Good prompt. I'm in Adelaide right now. I'm joining you from a co-working space I found here. So yeah, I'm in Adelaide for the week. My partner is a cybersecurity specialist and he is here doing a course all week. And so I thought, well, I can work from anywhere. So yeah, we packed up the dog and drove across the border. And there's literally a town called Border Town. I thought there would be a bit more of a song and dance, but there wasn't. We sort of slipped into South Australia without anyone noticing. And we're here for a week. So I found this fabulous co-working space and I'm in one of those phone booth pods that's all soundproof so I can do my podcast recording from here.
You should sneak around and see if there's any interesting health tech startups in the workspace there.
I just might have to do that. Yes, absolutely. All right, so should we get started with our first hot topic of the day?
Yes.
Let's start in Adelaide, since that's where I am, where an independent investigation is underway at South Australia Health. The Health Minister, Chris Picton, has initiated the investigation as it was revealed that the EMR may have miscalculated the due dates of more than 1,700 pregnant women. The so-called bungle impacted all public birthing hospitals across the state over a 6-month period. According to an internal South Australian health document, when maternity admission notes were opened in the EMR, the field containing the estimated due date was potentially overwritten by the last menstrual period calculation, and the incorrect data potentially led to some women being induced prematurely. Now, the investigation is in good hands with experienced clinical informatician Keith McNeil behind the wheel, and it'll likely take a couple of months. But in the meantime, SA Health is combing through medical records to uncover whether any mothers or babies experienced harm due to the error and to ensure such incidents do not reoccur. George, now, while this is not a good thing, of course, it is good, I thought, that it actually made the nightly news. I saw this on, Channel 9 or Channel 7 or something. It's good that there is transparency around the issue and people are being kept informed. What do you think?
Look, poor South Australia had a bit of a checkered run with its electronic medical records over the years. It's had a couple of hits and misses as it goes along. Look, I agree with you. It's good that the EMR is front and centre and people are talking about it. And as people like Enrico have been saying for many, many years, there are consequences of using these technologies. So you need to make sure you understand them properly and you have the checks and safeties in place. I think that the fact that Keith McNeil's there, very experienced health informatician with a strong background across many continents. He's seen technology issues come and go in the past, so I'm sure he'll get across it. But I think it'll also highlight to the people at the coalface that they really need to not just blindly use their systems, but assess them as they go along and look for these sort of issues that come up and have a process to get them fixed.
Yeah, absolutely. I mean, I thought it was interesting that the non-digital health press talk about the EMR making an error. And I'm like, does an EMR actually make an error? I don't think it's sentient yet. I think there are some humans involved along the way that made those errors. And it's important, of course, when we're using systems and when we're building them and when we're implementing them, that, of course, humans are responsible for all of that work and they're responsible for the use. So having an open mind and being mindful of what a system is telling you. And the other thing, George, you're a doctor. I know they look at the last menstrual period to calculate a due date, but I would have thought ultrasounds would be the most important data point to look at. Is that right?
Absolutely. From a staging perspective, ultrasounds are very important. But the reality is, I remember going back 30 years when we had kids, the obstetrician had this little round calculator where they picked the last menstrual date and it gave an estimation. So it is a variable that has a couple of other things that influence it. Ultrasounds are important as far as the staging goes. But having experienced 3 births of my boys, you know when it's coming.
Yes, I'm sure you do. And I thought it was also really good in the story as well that they highlighted the importance of transparency and the timely communication with patients as well, because most people outside of digital health assume when they see doctors or nurses or other types of clinicians type into a computer that those records are connected and available when needed. So the last thing we want is the first time people have experience of some sort of EMR system that it's a negative experience and they're told that the system broke. So hopefully that is being handled well with the patients affected.
And the key thing here, of course, is that the GPs would be involved as well, and they would have their own calculations. So again, that ability to share information so you can see where the discrepancy. So it should be able to highlight that it's a discrepancy. The GP system says one thing, and that's built on totally different software. So again, it demonstrates, the need for transparency around the challenges we associated with introducing these technologies, but also the benefits of that if they were sharing information broader across the system, they would be able to pick up on these things earlier.
Brilliant point. Very good. In big news from the mother country, the UK has a new government. With their newly minted majority, will Labor be able to save the NHS? Now, the National Health Service has been described as the closest thing England has to a national cult, but it has been crumbling for some time due to the pressures on the system, combined with chronic underfunding, or at least not funding the right things, depending on your perspective. Newly sworn-in Health Secretary Wes Streeting hit the press quickly with a statement, and he declared the policy of this department is that the NHS is broken. When I was diagnosed with kidney cancer, the NHS saved my life. Today, I can begin to repay that debt by saving our NHS. Interestingly, that same statement called out that one of his first acts was to negotiate with the Junior Doctors Committee to end their industrial action. Streeting has previously stated he wants to accelerate and disseminate successful innovation around data, encourage whole system innovation and harnessing new tech like AI. Streeting has also spent time as Shadow Minister looking at the Australian healthcare system, and he has said publicly that he wants the NHS to replicate our Victorian system, where AI is used to analyse stroke scans in every hospital, ensuring patients that need clot-busting treatment are quickly identified and fast-tracked. So yeah, it turns out the new Health Secretary in the UK was physically in Australia at the end of last year checking things out. George, what are your thoughts here? Can Streeting and the 1.4 million people who work within the NHS reverse its course?
I commented that South Australia's had its challenges, but the NHS probably outweighs them 100 to 1. Look, the NHS history is very, very interesting. It really is a core social service in the UK. And to say it's broken is probably hyperbole to some degree. It really has its challenges. The fact that one of the first things he's doing is meeting with junior doctors, because as we know, many of those junior doctors, once they finish their terms in the UK, jump on board a plane and come over to Australia because our working conditions are better. We've heard complaints from locally about our working conditions, and yet people are willing to travel halfway around the world to work here rather than work over there. So there are some deep ingrained challenges and issues they need to look at. And I don't think AI will answer all those questions. I do note they've had a number of reviews over the year. Every major digital health author in the United States has written a report in the UK about their NHS. But I think they really need to buckle down and think about what do they do to support their workers, because those 1.4 million people working in the NHS really are the core of that service, and they really need to be well looked after, not just well reimbursed, but their quality of life metrics also taken into account.
Yeah, definitely. And one of the things that those reports, like the WOCTA review, Topol, Goldacre, there's a whole bunch of them, they all call out the people who are basically the pulse potties, people who are interested in driving and leading innovations in health. I think they do a much better job of identifying the workforce needs when it comes to especially specialist positions regarding informatics. They don't shy away from health informatics like other systems do. They really have embraced it. And there's a lot of key people in those roles. You know, Keith McNeil, who we mentioned previously, had one of those roles when he was based in the UK. So I'm hopeful that if they continue to support the workforce, identifying the people people who have the interest and the skills and supporting them to do the jobs well, that'll put them in better stead.
I mean, one of the interesting things about the UK compared to Australia, of course, is that basically all the staff are salaried. So everyone's there, from the GPs all the way through to the tertiary specialists, are all employed by the NHS. So that does give them some flexibility with the way they can support that staff, but that does require them to culturally think about the staff's well-being as well as the well-being of the system. So, yeah, I think it'll be an interesting time. Having said that, I've visited the UK a couple of times. I've visited their hospitals, and I must admit, I've always walked away pretty impressed with what they're doing over there.
Exactly. All right, well, now staying within the Commonwealth, but closer to home, we all know about fake personas and disinformation online. But one clinic and their patients in New Zealand are combating a fake app. The Doctors Medical Centres is facing a fake mobile app that poses as its own official app. Now, the clinic quickly took action when they found this out. They reported it to the National Cybersecurity Centre in New Zealand to blacklist the app, and they reported it to Google to have it removed from the Play Store. The clinic has advised patients to download the official app directly from its website to ensure they're using a legitimate and secure platform. But while this has been happening in New Zealand, a research article has come out that looked at over 800 apps and found that user ratings and downloads do not correlate with objective quality indicators like data privacy and clinical efficacy. There's literally over 300,000 health-related apps available on our mobile phones. I don't know whether many users know that Apple and Google don't do any quality checking to make sure that the app does what it says it does on the box and actually protects your privacy. And don't get me started on the App Store platforms that allow apps that create things like fake porn using real people's faces. I saw a kid in rural Victoria was arrested last week for doing just that. George, I think this is a bigger story than just what's happening in this particular clinic in New Zealand. Are you, like me, just fed up with the lack of regulations imposed on these tech platforms? And then we have this poor awareness in the general community.
Well, they do say the greatest compliment is imitation. So, I guess obviously the Doctors Medical Centres must be doing something right if someone wanted to copy their app. But yeah, it does really highlight that challenge of the App Store model, and buyer beware is fine when it comes to buying a pair of shoes. But when it comes to getting a kidney transplant, you probably want a little bit more buyer beware than just a disclaimer on the website saying this may be false. Quality of the apps has been raised many times. In the UK, they have Orca, which has basically been looking at certifying apps and having a repository of certified apps that people can prescribe to. So in the UK, for example, they talk about prescribing apps and they come from that certified list. It'll be interesting in New South Wales when they go to the single digital patient record system. There'll be a single portal for accessing that whole system. Is that someone's going to copy, and who's going to be in charge of looking after those sort of things?
Well, and actually, off the topic of the app, the question of who's going to be in control is a good one, because I saw that they've just started advertising for the CEO for eHealth New South Wales. So we will find out soon enough, I guess, who ends up in that top job.
It'll be an interesting time because New South Wales is really leading Australia as far as the next stage of the EMR implementation. We've had one here for quite a while. It's a big project.
Surely is. Staying at home now, and I'm afraid I've got some bad news to share. Australian life expectancy has decreased. Yes, according to the Australian Institute of Health and Welfare's biennial report, Australia's life expectancy has gone backwards for the first time since 1995. A child born in 2020 to 2022 can expect to live 81.2 years for men and 85.3 years for women, which is a reduction of 0.1 years in both cases. Sorry, male potties, but women, we've always outlived you. The stats, they're going in the wrong direction. 92% of deaths are caused by chronic conditions. 66% of adults are currently overweight or obese. 94% of adults, that's almost all of us, don't meet daily dietary guidelines, and 61% of Australians have at least one chronic disease, and we know there's many people who have more than one. George, we're supposed to be heading towards longer, healthier lifespans and enhanced health spans. What's going on, and what can we do about this?
Okay, well, first of all, I'd say don't panic. 0.1 years in I'm not quite sure what the error bars are like on this, but 0.1 years is probably not catastrophic at this stage, considering we've just come off a worldwide pandemic. And if you look at some of the other countries, they've had a couple of years decrease. So don't panic, Australia. Things aren't as bad. We aren't all about to fall off the perch. However, it is part of our continuing work looking at what do we do to increase longevity? But as you and I have discussed in many forums in the past, it's not just lifespan, it's health span as well. So how do we make sure that people get quality of life during that period? Statistically, you have to be a little bit careful because, do you die with a chronic decision or do you die from a chronic decision? So we have to manage the hyperbole around some of this stuff. But the key thing, of course, is that century has been a significant increase in life expectancy. So we've jumped 40, 45 years in the last 100 years. So 0.1 probably doesn't worry us too much, but it does mean we need to start thinking about how we fine-tune our system because we are, I think, the second or third longest longevity in the world. So we're doing pretty well considering the challenges we face in Australia.
But we also have the longest period of any OECD country of years spent in ill health, which is 11 years. And one of the interesting things that I'm looking at now, and I know, George, you're spending a lot of time in this, is the role of digital health and related technologies and data into actually helping extend human health span and lifespan, keeping us healthier. There's so many apps and other programs that are related to managing chronic disease, but also preventing chronic disease. So am I wasting my time, or are we going to be seeing a big growth in the next 10 years? Because that's what I'm banking on.
I think it's really important. And like I said, what the challenge we've had, and I guess, I've been doing a lot more work in aged care over the last few years. So if we can reduce that disease burden going into old age, that will basically free up resources within the aged care service to better manage those who need it further down the track. Again, whilst some people are publishing books around that we're going to never die, I'm a little skeptical about that. And we've had many discussions about that. But the reality is many more of us are going to get into our 80s and 90s. And if we can protect the aged care service by decreasing the disease burden of people going into aged care, and I use that in inverted commas, I think we have a real opportunity to both improve quality of life for people, but also help that bottom line problem we have with the cost of the services we provide.
But then we've got the extreme end of that, as you indicated, where we've got someone like Brian Johnson, for the Pulse potties who don't know who he is. He's a tech millionaire. I'm not sure he might be billionaire, but anyway, he's spending millions of dollars every year to reverse his age. And I saw recently he hosts these dinners called Don't Die dinners. And recently he hit TikTok and all the socials with pics of his latest Don't Die dinner, which had the Kardashians as guests and podcast host Andrew Huberman. What do you think, George? Would you want to go to one of Brian Johnson's Don't Die dinners?
So many of our Pulse Potties friends know the hype curve. And in that hype curve, there's a thing called the peak of inflated expectations. And I think the best way to demonstrate that peak of expectation is to have the Kardashians there. The Kardashians really highlight the fact that you've really hit the peak of something, not necessarily all good. The other thing, of course, the interesting thing about that party is, if you read on further, Louise, it starts at 5 p.m. and finishes at 7:30 p.m. because Brian Johnson has to be in bed and asleep by 8:30. And I don't know about you, but some of my most fun moments in my life have been after 8:30 p.m. So I'm not quite sure I'm ready for a 5 p.m. party. But the concept's great. I mean, the idea that you can use science to improve longevity is important. And some of the stuff that he's sponsoring is going down that track. 150 tablets a day, eating only within a 5-hour time frame. I mean, there's some things there that are a little extreme and probably aren't scalable.
What about injecting yourself with the blood of your child? That's pretty extreme.
Yes. I suggested that to my kids. They said no.
Oh.
So again, I think we need to step back a little bit and look at it. And you're right. I mean, we've had the discussion, geroscience, longevity science. There's some really interesting and exciting research there. And I think there's probably a topic for one of our future interviews going forward. But we need to make sure we still stick with the good old tried and trusted evidence.
Yes, absolutely. Well, time for a quick break. And after this brief break, we'll be back with our special guest of Pulse. Today, we're going to be joined by the Productivity Commissioner, Catherine de Fontenay. Almost 7 years ago, Australia's Productivity Commission published Shifting the Dial. It was a landmark report which called out the importance of fixing healthcare to improve health outcomes, and they linked this to economic productivity goals for our nation. The role of digital health in enabling this reform was featured heavily in that report, and I certainly suggest you check it out. We'll put a link to it in the show notes. Well, the Productivity Commission are back with a brand new report called Leveraging Digital Technology in Healthcare. Now, the key headline for their research is that better integrating digital technology into healthcare could save more than $5 billion a year. Yes, you heard me right, $5 billion a year. Now, joining us today to discuss this report is Catherine de Fontenay, who's the Commissioner at the Productivity Commission. Welcome to Pulse, Commissioner.
Thanks so much. Great to be here.
Wonderful to have you here. Now, the Productivity Commission is known for the independent research you advise and that you prepare for the federal government, but some may be surprised that you've turned your focus to healthcare and digital health. So can you tell us a bit about why the Commission decided to enter the fray of the health sector?
Absolutely. So lots of people aren't aware that we've been in the human services space for about a decade, looking at aged care, palliative care, child and family services. But we've decided to set up a permanent team in health because it's such an important area. We know that on the input side, health costs are rising rapidly, and with the aging of the population, that's going to become a really pressing issue. At the moment, healthcare and social assistance has grown over time to employ about 15% of all Australians, and we know it can't be 100%. So we know that there are some real productivity issues that have to be addressed.
That's fantastic news that you've got a specific healthcare team. And so they've already got, I guess, their next piece of work. Maybe at the end we could talk about where you think they might be looking next.
Yeah, it is very exciting hearing that it's a dedicated healthcare team because, again, the market dynamics of healthcare are very different to many other industries. But looking at that market dynamics, one thing I quite excited me about the report is that you also looked at the economic opportunity to Australia of driving this industry. So in the last 12 months, I've been to Dubai, I've been to Hong Kong, I've been to Barcelona, I've been to India. Digital health is buzzing around the world and a lot of companies are springing up around the place. And, we've seen a lot of unicorns come and go. However, Australia has some really great technologies in play that we sort of don't do a great job of promoting. So what do you see being the economic opportunity of growing a local industry and then growing it externally? So if you just look at the Asia Pacific region, there's 3 or 4 billion people in just that region who don't necessarily need an American system because that's not designed for their system and don't necessarily need a European system. Can Australia become the digital health powerhouse here?
It's a good point. Australia already has a really strong biotechnology cluster, if you will, of startups and relatively developed firms like Cochlear. And so there's no reason that shouldn't extend into digital technologies. We've also got a really strong service sector more broadly, so it seems a natural area for us to play in. Some of those companies will be acquired from overseas, but that doesn't mean that we can't have a healthy ecosystem here. And more importantly, we want to benefit from those innovations in digital health from all over the world, not just the Australian ones. So obviously there are economic gains to having some startups here, but what's most important is kind of getting those good health outcomes for Australians and benefiting from digital technologies that are happening anywhere in the world.
But I think it's an opportunity for us to regionalize it because, again, having traveled to various parts of the world, healthcare in Asia Pacific is different to healthcare in America and healthcare in Europe. So there was that opportunity of Australia being the regional headquarters. I mean, in the past, Singapore's eaten our lunch many times in this regard. So keen to sort of really drive that.
Yeah, there's certainly a possibility. We haven't met many firms that are looking in that direction, but we were just starting to explore the startup space.
That's great to know. It's a real struggle for the Australian startups, more so than in other countries who are creative and work really hard to solve these problems. But most of them will have more success internationally before they have any success here. And we've seen too often companies have to pick up sticks and go to the US or the UK or Asia. Well, sticking with economics, anyone who's been in digital health for longer than 3 seconds would have heard many people say that, this is going to be an economic game changer. Productivity is going to skyrocket. But it's really difficult. If you go to the literature to look at economic productivity gains that are related to digital health, it is challenging to find literature. However, you have actually quantified in your report the impact that this type of innovation could have on Australia's economy. So what are some of the key dollar numbers in the report?
So that's a great question. We estimated the gains to public hospitals of using electronic medical records a little bit better, and we found that could be up to about $5.4 billion in savings. That's mainly from reduced time that patients spend in hospital from better management of their journey through the hospital. and there's 355 million a year in reduced duplication of tests. That's just in the public sector. So if we think of private hospitals, there are additional gains. And then telehealth is providing considerable savings, mostly to individual consumers. Telehealth is saving consumers about $480 million in travel time costs, we estimate, as an approximation, and about $415 million just in time waiting around doctors' offices, which we've all done.
I think that telehealth number is my favourite because most thing people complain about in the healthcare system. Most people have a really good experience with their clinicians. They like them. They feel that their clinicians, whoever they are, really care about them. But wasting time, the healthcare system, despite its efforts, is still far, far from actually being truly consumer-driven and patient-friendly. So in terms of these massive costs, we're estimating $480 million in travel time is saved, $415 million in time waiting around in a GP and specialist waiting room. Do you have any advice, Catherine? What do you think is going to be required for governments and indeed the health sector itself to pay attention to the potential massive economic savings and productivity boosts for doing things like telehealth as a default setting?
I think in telehealth, the battle's nearly won, although we could do more to have supported consultations for less advantaged patients and maybe some rural and remote. So maybe sitting with a health worker in a remote location to talk to a specialist in the city. But for many of us, telehealth is now a standard part of our healthcare. 1 in 5 GP consultations are now telehealth, so it's pretty much standard. In terms of other things like remote monitoring or artificial intelligence or digital therapeutics or better use of electronic medical records, one thing we've noticed is that when people adopt a clinical kind of mindset, that can really help these innovations get some traction. So we've shown in other work that Australia has terrific healthcare and is very good at folding in innovation from overseas. So when new clinical treatments become available, we're very good at folding that into our healthcare, finding out about it and making sure it's diffused widely. But we don't really think about digital technology in that way, do we? We think, oh, no, the hospital's going to make me do blah, blah, blah. And so what governments and hospitals have found is that when they adopt that clinical mindset and run it as a test and just show people, well, what are the gains to patients in terms of better outcomes? What are the savings to the hospital when we roll this out? That really helps create some traction. So, for example, South Australia has a virtual clinical care program, which is about monitoring patients who've been discharged from hospital. And they've shown that that has saved 1,300 hospital admissions and 1,000 presentations to the ED just in 4 years. So once you have the hard numbers, it's much easier to make the case that these innovations are really helpful.
I'm always a little bit cynical when it comes to the dollar savings because, having been here for many years, whenever someone comes in and offers a dollar savings, the finance department wants to see it on the P&L. And often these savings don't reflect on the P&L because, with healthcare, we have literally unlimited demand. So by making our services more efficient, we are seeing more people. So we're not necessarily getting cost savings. So is there a way we can approach this in a way that people understand that this is not going to be a consolidated revenue saving? This is going to be an efficiency gain in the system reflected in more equitable healthcare, better delivery of healthcare, happier staff. I mean, one of the big challenges we face in healthcare now is the staff burnout.
I think getting state governments involved makes a lot of sense. So you're absolutely right. At the level of an individual hospital, kind of reducing hospital presentations or emergency department presentations, that doesn't necessarily save you much when you're being funded in an activity-based system. But for the state, it does save them a lot, and it reduces that pressure on the whole system. So I think involving state governments in those conversations, the South Australia system was a state initiative. Royal Prince Alfred Virtual Hospital in New South Wales has heavy involvement of New South Wales Health. I think that's the right level to think about where those gains come in, because they're aware that there's huge pressure from the electorate to expand funding to healthcare. And so there needs to be those cost savings that can make good healthcare feasible.
we're heading into election season. It'll be interesting to see, because while at an individual level, people do want good healthcare and better healthcare and more access to healthcare, and in some places it's desperately needed, but it very rarely becomes a off topic of election coverage. Maybe we can think about, George, how we can use the podcast to get more people showing up to their electorate offices and demanding better digital infrastructure. We don't just need a building with bricks and mortar and a ribbon cutting ceremony.
Their voting card and their Medicare card together as they walk in. That's the way to get there.
I think that people don't always see that connection between the issue they're worried about. So if you think of something like hospital ambulance ramping, that's in the news all the time, and people are very worried about it, or waiting times for elective surgery. They don't necessarily make the connection between that and digital technologies. And I think partly that's because up to now, technological change in health has mostly delivered better health outcomes for the individual getting treatment. It's been a better medication. It's been a slightly better surgical procedure, stents and cardiovascular disease. And so we're used to quality improving in the hospital system. And indeed, we've done other research showing that Australia's had great productivity in its health system, mainly on the quality side. But we're not used to technology saving us time. And indeed, some doctors have had bad experiences with digital technologies and think it's causing worse care and more time. What we need is that evidence base that shows that, no, these technologies can really make a difference to your day-to-day delivery of healthcare and make life easier. AI supporting you as you're writing your recommendation for a patient, showing that 75% of patients who have these symptoms often have this condition, and run this test and ask these questions. Lots of things where we could get better healthcare, but also faster and cheaper.
And a good segue to AI there, because you've dedicated an entire chapter of the report to artificial intelligence. So good on you, because I actually think there's like some written rules somewhere that these days we're not allowed to have conversations about technology without talking about AI.
They'd be after us in a heartbeat.
I know. So yes, a whole chapter, people. Go and read it. But according to your research, AI could deliver benefits to our healthcare workforce by automating up to 30% of tasks and generating 11 hours back in their week, which sounds incredible. Does that figure apply equally to clinical versus non-clinical staff? And did you just look at hospitals?
It does apply to both. Obviously, administrative tasks are high on the list for time saving, but there have been studies where they've broken it down by task, and a lot of technician work could be automated. And then when we talk about AI, that covers a whole bunch of administrative tasks, not just tasks done by non-clinical staff. So think of writing up your patient notes after a consultation. If you have an AI app that is listening to the consultation and has written up your notes at the end of the consultation, that is a huge time saving. If you think of how frustrating it is for medical people having to spend so much of their time on administrative tasks, it's not just a time savings, but it also could make their job much more satisfying.
We've been looking at that area specifically in aged care as well. And the reality is we can use AI to improve tasks, but we need first to understand what our tasks are. So it actually provides an opportunity to reflect back on how we deliver healthcare, because I often tell the example, I went through med school 30 or so years ago. I learned to do medicine a certain way. My son recently graduated and he got taught exactly the same way. And if you look at some of the ancient writings of Hippocrates, they're pretty much the same way that I was trained to do things. So reassessing how we deliver healthcare and the tasks is part of that. And again, AI is a great tool to then improve on those tasks. And I think that's where reports like yours really play a role, recognizing that there's inefficiencies in healthcare that have become ingrained. We can improve on them, but we need to think about how we do that.
Absolutely. And if we think of getting technological change among health workers, it's an awful lot like herding cats. So the cats would have to see that there was something in it for them.
100%. Actually, that was my PhD thesis. I looked at technology acceptance amongst clinicians, and the summary of my 100,000 words that I wrote, and I don't think it's changed a hell of a lot, is that actually clinicians will persist even with technology that's poorly designed, and that even does take them longer than they think it should, but they'll persist providing they see the clinical benefits and the benefits for them and their patients. That's the key thing that drives them.
Well, that's encouraging.
And it's good to reflect on because, again, having watched sort of the transition from paper to computerization, yes, a lot of my peers complain about, the EMR's too slow, it's too clunky. But then when you offer them the opportunity to go back to paper, it's like a no. We've actually come quite a long way.
That's very funny. That said, there's lots of things that we have to think about more about how to integrate things into workflows. Those numbers that we got estimating the benefit of electronic medical records, that's not relative to paper. That's relative to crappy use of electronic medical records. So when hospitals take the time to really co-design it with the staff to develop something that really supports them in the way they want things done, which instead of dumping information at them, prioritizes the information so they're getting the right information at the right time. We've heard that some doctors still like to use faxes. Well, why do they like to use faxes? Because when they send a fax to the hospital, it goes beep, 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 and someone has to walk by it and sees that there's paper there, has to pick it up, has to read it. If they send an email about an urgent condition, who knows when that gets read, right? There's no system for prioritizing email. So we need to think about how to properly make these systems work for best healthcare outcomes.
It's interesting because, if you look at EMRs have been around for a long time. And I remember there's a great video of the first EMRs being run by GE back in the 1960s. So it's a transitional phase. It's not a set once and forget. And the same way all our apps on our phone keep on getting updated, our EMR gets updated. But I was at a talk yesterday and they were talking about the new New South Wales project, which is a single patient record across the whole state. It's going to require us to readapt.
Yes. At the same time, as we develop these fancy new systems, we want to think about what's the least cost way to do it. So at the moment, different states are developing their own electronic medical records system for the state separately. And those systems are separate to my health record. And some of those systems are starting to talk about undertaking the same role that we have for my health record. So there's clearly some duplication going on, and it's worth thinking about whether we're getting all the efficiencies we could be.
Definitely. That'll be the goal that we set ourselves, actually, I think, is how do we get the states and the feds not blaming each other, working together collaboratively and making sure the system all works as one. I know that's what they want to do, but it's a challenge.
Isn't that called constitutional reform?
I know. We don't want to give WA another excuse to leave the union. They always threaten that, seceding, and I can say that, being a West Australian myself. So look, final thoughts, Catherine. Any message that you'd like to leave our listeners with and anything that you want to say to the healthcare providers, policymakers, and indeed the general public about the importance of embracing digital health innovation?
Look, we think that the benefits are huge. And one thing that's exciting about certain areas like telehealth and remote monitoring is some of those benefits are really perceived by consumers and not just sort of city consumers, regional and remote. We think there's lots of really exciting potential there. The challenge, though, is kind of getting everyone on the same page in terms of the right funding structures and awareness of these innovations to make sure that we're getting the most benefit out of them possible.
Sounds good. Well, look, thank you so much for spending the time in the PulsePod studio today, Catherine. It's been great having you here.
Thanks so much. It's been great.
And we look forward to hearing more about the health work of the Product Review Commission.
Terrific.
Now it's time for an update from our correspondent, Kate McDonald from the Pulse+IT News Desk. Welcome, Kate. What have you got for us this week?
Hello, Louise, and hello, George. I know George will be following this closely. Some of the big news over the last week in Australia has been the release of a National Aged Care Data and Digital Strategy and Action Plan, which sounds very exciting. We've had a lot of roadmaps and blueprints released in the last 18 months, including a National Digital Health Strategy, a 10-year Digital Health Blueprint and Action Plan, a National Healthcare Interoperability Plan, and we're all joking now that we've got plan fatigue. But this aged care data and digital strategy is a very important one. It sets out the Department of Health's vision to improve the provision of aged care using technology and also to fulfil some of the recommendations of the Royal Commission into Aged Care Safety and Quality that we had a few years ago. But for me, it's the action plan that accompanies the strategy where everything's happening. It outlines 20 or so big projects for aged care including integrating the My Aged Care system with the My Health Record system. Now, we've been reporting on this for 10 years. I actually went back and had a look through some of our older stories. And George, you spoke about this on a panel at ITAC in 2014 when the My Aged Care system was first being developed. Central client record, and it was outraged that the idea there'd be two different records, a My Aged Care record and a My Health record. A lot of information on the Pulse+IT website about that, but part of the action plan is that those two systems will be integrated. It doesn't say how they'll be integrated, but that's the plan anyway. There's also a lot going on with standardisation of data and standards for clinical information systems used in aged care. And there's a lot of intriguing pilots mentioned in the action planning, including virtual nursing in aged care, virtual reality trials, and how AI can be used to improve care. Now, George, you're the expert on aged care informatics in Australia and around the world. What do you think of the action plan and the strategy?
Well, first of all, I have to say I'm impressed that you can pull up something I said in a panel 10 years ago with such accuracy, Kate. So thanks for that. I'll start off by saying, look, this is my personal opinion. This doesn't necessarily represent any of the peak bodies that I'm associated with. This is just my feeling because we haven't had a chance to really dig deeply into this yet. But I think it's really exciting that the aged care data and digital strategy has been released. And I was actually at the ARIA conference when Josh and the team released it. And it really is a positive first step. You're right. It's quite a good document. I mean, it's visually very appealing. I think that's been done very well, but it actually has content in it and it's very well structured and it gives us a really good idea about what the overall strategy is and how it aligns with the other government strategies. And I do know that the team behind it put a lot of work into making sure that alignment was in place. The one thing, and as you pointed out, I think is the inclusion of an action plan with detailed outcomes and associated actions is great. And the fact that it's actually being released with the strategy, not 3 years later when everything's come off the boil. And many of those actions really provide a focus for both the providers and the vendors to develop solutions because they sort of know what are the areas that the government's willing to invest in. I do note that many of those ideas sort of have been projects that have been highlighted in many of conferences over the years. And we've had many of them won ITAC awards and we've seen them at conferences. The key thing I think here is the government's transparency, the fact that we're actually involved in these discussions. And I really have to say that I take my hat off to the First Assistant Secretary, Faith Labara. She's done a really good job in keeping the industry informed. Every 6 weeks or so, she has a big online event where she talks about what's happening. Every 2 weeks, they have a more closed event for people more actively engaged. So communication, having worked with governments in digital health for 25 or 30 years now, this is the most communication we've had for a long time. And the people behind it are really active and engaged with it. The challenge still remains, of course, that at the moment, most of that investment still sits behind the government walls. So the providers are a little bit nervous about what does it mean for them. So the one thing I've spoken to the government about, and we've said this public a number of times, is we need to have a little bit of a roadmap about how the providers and the vendors were going to move forward because the government's modernisation that they've done is amazing. I mean, they've picked a product, they've doubled down on it, they've invested in it, significantly improved the back-end systems. Now we need to know is how the providers can take advantage of that, how they can make sure their systems are capable of doing that. And I think that's really going to be where the rubber hits the road. If I can use this opportunity to ask the government and department, maybe next year's budget, we should really be considering how do we support providers to procure and utilize systems that are going to take full advantage of these new changes.
I think that's what the providers were worried about. There was a huge amount of money allocated in the recent budget, $1.2 billion to aged care. And the providers were saying, well, where's it all going? And are we going to get any? Because they really do need assistance with implementing technologies. Aged care has always been the late getting anywhere in terms of technological advancements. And I think the providers in particular are asking for financial assistance to get technology implemented.
And I think it's a stage-wise process. They had to update the back end before they can update the connection. So patience, unfortunately, is something we need to develop in this space because we've seen when you rush these projects, bad things happen. I think the timeframes in the strategy are reasonable. reasonably aggressive as well. So they're not sort of giving us a 20-year timeline. They're giving us 5 years to make things happen. I'm fairly confident that we'll have a lot of that delivered, but I'm really looking forward to those actions that they're talking about and those projects and seeing how they play out. And again, this gives Australia an opportunity to become a hub worldwide about how we integrate aged care, healthcare, and social services more effectively. Maybe we can start pushing up that longevity thing we were talking about earlier.
I think we should also give a bit of credit to the Australian Digital Health Agency. They've been working with the aged care software vendors very closely on standardisation, on interoperability, and there's been some really good work that's flown very much under the radar in terms of electronic prescribing and joining up the pharmacy, the aged care facility and GPs in software to allow that everyone to be on the same page when it comes to medications for residents of aged care facilities. And some great work has been done there. We're also following closely a lot of stories about AI and how it's being implemented, particularly by the global EMR vendors, the big guys like Epic and Oracle, formerly known as Cerner, Meditech, Daedalus and InterSystems. They're all investing heavily in AI to enhance clinician productivity in particular. I think it's still very early in terms of clinical decision support systems using AI, but workflow and productivity is a big area for the EMR vendors, especially using generative AI for medical scribes and also for AI assistants or co-pilots for using chat-based searching of complex medical records. It's a really interesting area. They're also using ambient listening technology. They can listen into a consultation and pick up things such as orders for prescriptions and labs and imaging. This sort of technology was pioneered by Nuance, which is now owned by Microsoft, and it's being integrated into some of the big EMRs. I know that Intermountain Healthcare in the US is using Nuance's technology across all of its facilities, and they're also moving over to a unified Epic EHR as well. And here in Australia, InterSystems just last week announced that it will be adding AI-powered ambient listening to its Track Care platform, which was first developed in Australia, as well as an AI co-pilot. And we know that Meditech has been working with Google on AI-based search of medical records, and Cerner is also working very closely with Microsoft, and we'll have a story about that this week. In other news, New Zealand is still grappling with the ramifications of $300 million worth of cuts to its digital health in the recent budget. A new government policy statement on health was released last week, and digital infrastructure was one of the priority areas. But while it talks about renewing physical and digital infrastructure, there doesn't seem to be any money for it, which is unfortunate. But as the new Health Minister, Shane Reti, has been saying quite a lot, Health New Zealand is now working on a 10-year infrastructure investment plan that will include digital assets. We think New Zealand might develop plan fatigue as we are here in Australia as well. And finally, over to Ireland, where they've also got plans. They recently released a digital health strategy, or framework as they're calling it. And they also have an implementation roadmap for that framework. It was supposed to be released last week, but it hasn't surfaced as yet. So hopefully that will be available this week. Everyone's got a plan, which is good.
Or 10 plans, however many you need.
There are lots of plans out there, and I guess you need to plan to succeed. It's important that we have plans. That's why I said I was impressed that the action plan was included with our strategy so that we actually have actions. The AI listening, what do you think about that, Louise?
Well, I have a real strong interest in that because, again, I'm dealing with family members who are not in great health and I can't be there with them. So I've said, look, just tell the doctor you're doing it, because I think that's the polite thing to do, but just get out your phone and press record. Because then you can listen back about what the advice was and then you can share it with me. Anyway, that freaked out my parents, so that has not happened. I've said this to a lot of doctors that work in oncology. Doesn't matter how old you are, how intelligent you are, you tell them the bad news that they've got cancer, your brain just goes into shutdown mode. So what I really want to see with these technologies is actually a cultural acceptance, because the technologies are great and today they're going to be the worst they ever are, but a cultural acceptance of giving people access to their own information and using technology as an enabler to make that easy and to make it transparent. I was talking to a hospital recently and they said that they had a PhD student who came up, this was a few years ago now, great idea, and built this technology that would record consultations and would actually create a version of the note for a patient and a version of the note for clinicians. And I was like, brilliant. Anyway, that idea had to get approval from their board, and it met every other yes, 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 all the way through. The board shut it down and said no. I think this is more of a cultural issue than a technological one. What do you guys think?
I agree with you. I think there's both a cultural issue and, as so many of the discussions we've had with the patient advocates, clinicians probably need to better communicate what the message is as they expect it to be. And whether AI is the tool that helps them do that, we'll need to watch and wait and see whether that does work. But I still think the clinician cultures needs to be much more focused on patient communication and improving patient communication. I think it's important. And also standardizing the way we report across the whole system, because there's so many different ways. I watch it with great interest. I think it's a great use of AI, and chat-based searching of complex records, I think is great. I mean, I'm an old Star Trek fan, so I'm used to Jean-Luc Picard just tapping on his shirt and saying, "Computer, tell me where the blah, blah, blah is." So, yeah, I want to be able to do that in the future as well.
I think the generative AI in terms of the medical scribes is probably where everyone's at the moment. And if you see it in action, it really is quite remarkable the way that a doctor can do their notes in their shorthand, and it in 30 seconds converts into a referral to a specialist. It converts into a patient note, and you can print it out or email it to the patient. And I think that it's remarkable, the capabilities that it has. Obviously, there's legal and ethical things to keep in mind, but when you see it in action, it's quite remarkable.
Absolutely.
And poor old New Zealand. 12 months ago at MedInfo, they were the star. They were going to have this amazing new digital strategy. Everything was coming along. And along comes an election and a budget cut, and we're back to where we are. What's your thoughts there?
It's so frustrating. I really feel for them. And I think this is, again, a job that all of Pulse Potties and the digital health community, this is our responsibility. You know, we have a responsibility to make sure that people who, not just the CIOs and the techs and the clinicians, but the people who control the purse strings, that they actually understand how important this is. And it's not a cost overhead. The cost of not doing these things is much higher. I think it's a real role and a responsibility that our entire community has, is to educate these people. I'm not saying it's easy, but to not have them in the room, it's no wonder this sort of stuff happens.
Some of our best minds went over there a year or so ago, so it'll be interesting to see whether they have to come back home now, but there's opportunities here for them as well.
And I've got a bit of news. Next Monday in Canberra, the Australian Digital Health Agency is holding a briefing for interested people, vendors included, in where we're at with their modernisation program for My Health Record. A lot of people will know that it's based on clinical document architecture, and they're moving it to a new repository built on FHIR. And we're going to have a lot more detail on that on Monday. So we'll bring you news on that on the next Pulse podcast.
Brilliant, Kate. Yes, the whole digital health community will be descending onto cold Canberra. So, Kate, thanks for such an informative update, as always, and we will see you online for the next episode.
It's been fantastic. Talk to you soon.
Thanks, Kate. Keep up the good work.
George, episode 2. What did you think? How good was the Productivity Commissioner?
The Productivity Commissioner was very impressive. I had the opportunity to meet her late last year when she presented at a conference, and she was switched on. She knows the stuff. It's really exciting that health is a key focus of the Productivity Commission, because we keep on having these isolated discussions. So I was impressed, and I look forward to further collaboration with the Productivity Commission going forward.
Absolutely. I really applaud that they have set up a health dedicated team. Other countries have actually funded think tanks that are paid to write policy papers and thought leadership papers that are truly independent and don't have any commercial bias attached to them. And that's always been something that's been a bit absent from the Australian sector. So I'm wondering whether that might be partly a role that the Productivity Commission ends up playing with their health research team.
Yep, and I think it's important that we as a sector engage with them because some of the things they discuss may have been a little bit through rose-tinted glasses, so they probably need to better understand some of the realities on the ground. But I think the fact that, like you said, this isn't one of those classic reports which tells us that the market's going to be worth $500 billion in the next 3 years. We keep on seeing, and every 3 years that same report comes out, but just with the dates change. So I think that having an independent body that can do the research behind it is critical. It would be great to see all these government departments probably working a little bit closer together and making sure they're all working in the same direction. I really enjoyed that discussion with the Productivity Commission. I'm looking forward to more.
Well, George, it's always a pleasure. Now can you read us out?
Thank you for listening to Pulse, brought to you by Pulse+IT News. Pulse+IT is produced by Ivan Jurek of Octopod Productions. Thanks to Nigel Chartres, Emily Mara and Kate McDonald for contributing to today's episode. Subscribe, follow and rate Pulse wherever you get your podcasts. You can subscribe to Pulse+IT magazine at www.pulseit.news and send your feedback and questions to pulsepod@pulseit.news. Thanks for joining us.